We found that the normalization of free light chain are associated with the duration of the PFS. It means the control of the disease and the response and the deepness of the response is very important because it is not only the free light chains but also the MRD. Patients with MRD negativity were most associated with a longer PFS, and MRD negativity at 6 months post CAR T were about 80% in patients with long PFS longer than 15.7 months, but only 30% of patients with a shorter PFS. It was previously shown that response rate was associated with baseline inflammatory system response, but now we have also shown that CRP level or ferritin level at the time of lymphodepletion was associated with the duration of the PFS. And also when you look at inflammatory cytokines like TNF-alpha or IL-10, it was also associated with the PFS.